Good evening, everyone. Thank you so much for joining for today's webinar. Today's webinar is organized by MOHAN Foundation and Care for Your Kidney Foundation. Topic for today's webinar is diet, water, and salt consideration to prevent kidney disease. To prevent any disease for that matter, diet plays an important role. So today we have with us Dr. Satyanarayana Gare, nephrologist at Apollo Hospital, City, Hyderabad. Sir, good evening and welcome with Mohan Foundation and Care for Your Kidney Foundation.
Good evening, everyone. Thank you. I'm happy to be here today evening. So I'll enlighten you a little on what exactly you need to eat and your diet and salt and water considerations in the general population and in renal patients as well. So I hope you can see my slides now.
Yes, it is visible.
Yeah. So good evening, everyone. I am Dr. Satyanarayana. I'm a nephrologist and transplant physician in Apollo Health City, Hyderabad. So I'm here to talk about diet, nutrition, and salt considerations in food to prevent kidney disease. Now, to know what is right, you should also what is wrong. You should know what is right also. So, as body is a balance of different organs and different systems, in a diet also we need to have balance. So you need to have something called as balanced diet. That's a concept which is coming up now, which is a balance of each and every aspect of your diet. So what exactly is a balanced diet? So a balanced diet is getting right amount of food and drinks to supply the nutrition and energy. You need this nutrition and energy for your body cells, tissues, and organs, and this will help in supporting your normal growth and development. So now, when your diet is doing this, it's called a balanced diet. Now, what do you have in a balanced diet? In balanced diet, I'll show you something called as a food pyramid now, which is very important, and try to consolidate on what you should have on a daily basis. Now, this is a food pyramid. The top one, the right corner was the old one, which I'm not going to talk now. The newer one has an addition of exercise in the food pyramid. Now, in a food pyramid, exercise is a part and parcel of having a healthy diet and healthy lifestyle. So it is recommended to have at least 30 minutes of physical activity for adults and 60 minutes of physical activity for children. So by staying 30 to 60 minutes physically active, you will not put on weight, and it will help you in reducing the weight also. Now, what should I have in my food? So what are the components of my food? So to put in broad categories, you should have grains and try to consume whole grains. So that's the recommendation. You should have at least 6 ounces. It's around 180 grams of grains and vegetables. You should vary the types of vegetables, at least 2.5 cups of vegetables and fruits. You should eat a variety of fruits, at least 2 cups of fruits, but you should reduce the juices. You should try to take the whole fruits. So oils, I'll come to the oils later, and milk and milk products. Try to take low fat or skim milk or fat free dairy products. You can have up to 3 cups, which is around 150 ml. And coming to meats, so try to, when you're trying to take meat, take lean cut meats, which is healthy for you, and seafoods, and avoid frying these foods. So that will help you in maintaining the systems of your body. Now coming to the oils, so you should make sure that your most of the fat should come from your nuts and vegetable oils, and limit solid fats such as butter and ghee and other things, and try to consume less saturated fats and trans fats, and take less sodium. So this is the whole concept of balanced diet. You should have each and every component of the food in your daily intake, and you should have exercise as a part of your food pyramid. So keeping this in mind, we'll see what is a renal diet. Now, renal diet is a diet which is given for the kidney patients. It is not to prevent the kidney disease, but who already have a kidney disease, we advise them something called as renal diet. Now, when the kidney functioning is normal, generally we don't advise them the renal diet. The reason being, it is very difficult to follow. It comes with a lot of restrictions, and with these restrictions, sometimes most of the times patients will not eat properly and they'll go into malnutrition, and the quality of life will be affected. So the recommendation says that when you have a normal renal function, which is measured by your GFR, which is the filtration of your kidneys, you should be normally more than 60. When you have that, we advise the same dietary recommendations as for the general populations. Now, this is for the people who are long-term diabetics, long-term hypertensives, who are high risk for development of kidney disease. So all these people should have a healthy diet, which are roughly low sodium, and avoidance of red meat and processed meats. Try to consume more amount of whole fruits, vegetables, legumes, and if you are eating non-vegetarian, try to consume white meat like fish and poultry. Avoid red meat. So these are the general recommendations or blanket recommendations, I would say, which is very gross, and it should be back of your mind whenever you're eating. Now, as I told you, kidney diet comes with many restrictions, which I'll be telling you in the further slides. And adherence to such a diet can be very difficult and problematic. With this, the quality of life will going to come down. So generally, we don't advise renal diet for patients who are not having any kidney disease, but we advise these restrictions or these dietary recommendations for high risk populations. Now, roughly, what are the guidelines given for kidney patients? If any kidney patients are watching, roughly what are the guidelines? Always make sure that you get adequate calories. So you should have at least 25 to 35 kilocalories per kg of your body weight. Now we have multiple apps to calculate this. Don't neglect your calories. Your calories are very important. The calorie deficient diet is going to it will make you malnourished. Now you have a protein recommendations. I'll just tell you, don't need to mug up these numbers. So roughly this says that you should have a restricted protein diet. You should have a low sodium diet, low potassium diet, a moderate calcium, and avoid foods with high phosphorus. But include everything like vitamins and trace elements, which I'll be telling you later. So roughly this is the essence of this guidelines. Now, what are the nutrients we are talking about? We have two types of nutrients. One is the major nutrients, which includes proteins, carbs, and your fats. The other one is the micronutrients, which are minerals like calcium, magnesium, phosphorus, zinc, and selenium. And you have vitamins, fat soluble and water soluble. And you have water. I've included water in the nutrients list because it plays such an important role in your daily life. Now, let's see each and every aspect of these nutrients. So I'll first talk about the proteins. So these are the tissue and muscle building components of your diet, and it boosts up your immunity, and it helps you maintain the fluid balance. It also helps in healing. So when you're deficient of protein, your muscles are going to go weak, and you will have low immunity, and you're prone to infections. So you should not do that. So you should have a good amount of protein, which is how much protein you need to take and what kind of protein you take is also important. But some important sources of protein include milk products, soya beans, dal, egg, chicken, and fish. Now, coming to that, how much protein you should take. Now, how much protein you need to take depends upon your age, your sex, your body weight, and your physical activity as well. So I'm being a sedentary worker because most of the time I'm sitting in the hospitals and I will not be doing physical activity on daily basis. So I do only 2 times a week. I will not take the same amount of protein which is being consumed by an athlete who works out every day. So it doesn't work out like that. So you have to know how much physical activity you are doing, what is your weight, what is your age, and how much protein you need. So this is the guidelines given. So we'll just talk about adults now. Anybody who's above more than 16 years of age and approximately 60 kilograms will require around 72 grams of protein. That is roughly equal to 1 to 1.2 grams per kg of your body weight. So that's the recommendations. Somewhere between 0.8 to 1 or 1 to 1.2 grams of protein per kg of your body weight. So whereas in an female, it will slightly come down to 0.8. Having said that, what kind of protein is good for you? Animal protein versus plant protein. Most of the patients ask me this question, which is good, animal protein or plant protein? Now, when you look at the literature, when you look at studies, there is no clear winner here, animal protein versus plant protein. But there's many observation studies which says that patients who are consuming plant protein is easily digestible, they have less side effects, they have more benefits in terms of progression of diabetes or hypertension or progression of kidney disease. These are observation studies. So always I prefer plant protein over the animal protein because you get a lot of antioxidants, you get a lot of fiber in plant protein, which will be lacking in the animal protein. So, and there are many studies to say that the gut microbiome, the microorganisms which are present in the stomach are altered with the animal protein, whereas plant protein will not do that. So, so I'm not saying the plant protein is bad.
Dr. Satyanarayana, cracking.
Hello?
Your voice is cracking.
Even your voice is cracking. Hello?
Yeah, am I audible?
Anjali, your voice is cracking.
Yeah, same here. Actually, we cannot hear.
Can you hear me, Anjali, now?
No, it is still cracking.
Even your voice is cracking. I'm not able to hear you properly.
Actually, there's some problem with your side only, because Anchal's voice is clear for me. So there's some problem with your side.
MOHAN Foundation thing is also it's not clear at all. Can you hear me now?
Yeah, yes, but still the disturbance is there. Can you try joining from a mobile or something like that? Some other device?
So, am I audible right now?
Yeah, yes, ma'am.
Okay, the voice is cracking or not?
Good night.
Okay. So, as doctor has already mentioned that for the nutrients, we have major nutrients which are responsible in our diet. Then there are other nutrients, and then he has also mentioned about water in his diet. So he was discussing about animal proteins versus plant. So let him rejoin it again. Yes, Dr. Satyanarayana. Mean, Meanwhile, those who have any queries, please write down on the Facebook live chat. We will definitely answer all the questions. Over to you, doctor. You are on mute.
Just give me a couple of minutes.
So we have already been receiving a lot of questions. We have received this question that what kind of we need to avoid for patient.
Just 1 second, Achal. Just give me 1 minute.
Yes, sure, no.
There's multiple
Their
devices
queries,
off.
down their queries, and talking about what soil operations for kidney patients. So doctor has touched upon the diet, renal diet for those who are having kidney disease, and then further he is elaborating on what are the topics. Yes. So let us revise a little what Dr. Satyanarayan Gare has discussed. He has taught about proteins, and he shared that proteins are the building blocks. It helps in healing. It helps in regenerating. So and he also mentioned that for proteins we need to have a lean lean meats. We don't have to have a tender meats. So and some seafood which is safe for in renal diet. So yes. Yes, doctor. You're audible now. Thank you.
So I think I left you with the
Can we zoom in a bit, please?
this one second. I need to.
Yeah.
Can you send the PPT to me? I'll share it from my side.
How do I send you the PPT?
Yeah, to my mail ID. I'll share it.
This.
Dr. Satyana, can you continue talking, please, so that
Yeah,
the
please. Sorry.
audience...
Sorry.
Thank you.
So I think I'm not able to show you the slides, but so where I left was the animal protein versus the plant protein. So what I'm trying to say is that the plant protein have better digestibility and they are rich in fibers. They have many antioxidants. So we have many observational studies which were actually showing that the plant protein is better when compared to the animal protein on the ease of digestion, and it has a lot of antioxidant properties. Now, having said that, I'm not saying that the animal protein is bad, but try to avoid the red meat, which is actually not good for your body, and try to increase your lean cuts in your meat diet if you are taking the meat diet. So there's a different protein recommendations for the renal patients. So as your kidney function declines, that means as your creatinine goes up, as your other functions of the kidney is coming down. So what we try to do is we try to reduce the protein content in your diet. So now this will reduce the pressure on your kidneys. So this doesn't apply for the normal kidneys. So when you have a kidney issue only, you try to take the less protein diet. When your kidneys are normal, you tend to take the normal protein diet. Now, having said that, again, you should be very careful in taking what protein and how much protein you're taking. Too much protein is not good for you. So we have many patients who keeps taking a lot of these protein supplements and coming to us with a lot of renal issues. So don't try to overdo your protein. Protein is good for your body, but when you take in excess quantities, it can harm your kidneys as well. So that is one thing. And eating a plant-based low protein diet is recommended for renal patients. So this will be very good for for the kidneys. It will actually reduce the progression of your kidney disease. So after that, I'll talk you on the carbohydrates. These are building blocks. So on day-to-day basis, you need carbs for your routine activities. Now the carbs are two types. You have a simple carbs and the complex carbs. Complex carbs are like your fiber, which is very good, and simple carbs are like your refined sugars, glucose, and other things, which is actually not very good, but still you can take in a decent amount of quantities. Now, fiber is very good for your health. It will help in weight reduction. It will help relieve your constipations, and your intestine will become very healthy. Now, what are the major sources of the carbs? Is the wheats, oats, bran, vegetables, and other things. So if you take too much carbs, especially the refined carbs or the simple carbs, it will lead to something called as metabolic syndrome or obesity, or it can lead to hypertriglyceridemia or cholesterolemia. That means your cholesterols are going to go up, and you're prone for other cardiac disease and all those things. And when you take too low, it'll cause you constipations. It can cause you starvation, ketoacidosis, and all those things. Now, the point I'm trying to make here is you have to take everything in a balanced way. You can't overtake anything or you can't undertake anything. So you have to take the proteins, the carbs and fats, everything in a balanced fashion. Now, the next comes the fats. Now, the fats fat is very important for your body. So it covers all your organs, insulating all your organs. And when your body is running low on carbs, fat will be converted into the carbs. So again, as the carbs, as carbs, fats are also two types. You have saturated fats and unsaturated fats. So what are saturated fats? Which are like your ghee, your butter, and your coconut oil. All these are saturated fatty acids. Saturated fats are not good. And you have unsaturated fatty acids, which are liquid at your room temperature, like your omega-3 fatty acids and omega-6 fatty acids, which are good for your health. So where do you get this omega-rich fatty acids? Like your olive oil, rice bran oil, soybean, groundnut oil, mustard oil. All these things are rich in omega-3 fatty acids or unsaturated fats. So you should have a good amount of omega-3 fatty acids, and deficiencies will cause you vitamin deficiency and several skin and nervous disorders. And excess fats, as you know, will cause weight gain and elevated blood pressures and cardiac disease. So you see, I told you multiple times that you should have a balance. You should have a balance of carbs, proteins, and fats. So what is the balance I'm talking about? So if you have, if you take the diet as a number, say it's 100%, 65% of your total diet should be carbs, because that will keep you running every day. It's like petrol in your body. So you need carbs to run your daily activities. And protein, as I told you, can range anywhere between 0.8 to 1 gram per kg of body weight. That will constitute to around 20 to 25%, and around 10% of fat is required in your daily diet. So which will roughly approximately 3 to 4 tablespoons of oil or 1 tablespoon of ghee. Now, what happens when you don't take this balanced diet? So if you take anything in excess or anything less, you will be prone to something called as protein allergy malnutrition. So I'll just tell you a recent study which was published in Indian Pediatric Journal. So in Madhya Pradesh alone, we have 53% of the children who are malnourished, and unfortunately, 30 to 40% of them belong to upper middle class. So the malnourishment is not malnourishment is not because of lack of food. It is lack of proper food. So that means they're not having a balanced diet. That's the reason why even these upper middle class people also have protein allergy malnutrition. Now, when you take less fiber, you can have colon cancers and other stuff. Okay, so the incidence of cancer is also rising because of lack of awareness of this balanced diet. So you need to have fiber. So you need to have fiber in your diet, and inclusion of protein in your diet, inclusion of carbs, and inclusion of moderate amount of fats. So you should have everything in your diet in a balanced fashion. Now coming to the minerals. So we have macro minerals and the trace minerals. The macro minerals includes the potassium, calcium, phosphorus, iodine, and sodium. And the trace elements includes copper, iron, fluorine, and zinc. Now we'll talk about the salt, which is or sodium. Salt is roughly equal to sodium, not exactly, but that's what we consider. So sodium is very important in your body, and it regulates many functions. So functions like fluid balance, your muscles, your hearts, and your nerves, everything requires sodium. But too much of sodium will contribute to the blood pressure, and you should have a balanced sodium. Now, what do you mean by a balanced sodium? Generally, we recommend patients to have somewhere between 5 to 8 grams of sodium per day. Now, this is mostly for high-risk population. That is, patients who are suffering from diabetes and hypertension and renal disease. For renal disease patients, we'll restrict the salt to 5 grams per day. So what do you mean by 5 grams per day? This 2.5 grams of sodium roughly. This is equal to 1 teaspoon of sodium, common salt, the table salt, which you're having. 1 full tablespoon will constitute you 5 grams. So you can have up to 1.5 to 2 spoons of salt if you're high risk population. And if you're normal healthy individual, you can have up to 8 to 10 grams of salt, that is around 2 tablespoons. Now, it's very difficult. I mean, it's easy to say, but it's very difficult to follow. So what we advise our patients is to cook your salt cook your food without salt and add the salt later. So you can have your small boxes of 1 gram or 2 grams of salt, and then keep adding whenever you're eating your food. So essentially you cook your food without salt and then add it. Now, the other thing I come across recently is most of the patients healthy individuals and high risk populations are using something called as low sodium salt or the Lona salt, which is widely advertised and widely available in many supermarkets. So I recommend patients who are diabetic and hypertension and who are taking some drugs for hypertension and kidney patients not to take this low sodium salt, because in the place of sodium, these salts will have potassium, which is not good for you. I'll be talking about potassium in next couple of minutes. So low salts are not recommended, especially for high risk population. The general healthy individuals or healthy adults can take Lona salt in limited quantities, but try to cut down salt because your hypertension is not going to come in 1 day or 2 days. So your health habits in the last decade are going to count for your hypertension. So you need to have a healthy lifestyle to prevent your future comorbidities. Now, the most common question in our day-to-day outpatient basis we are asked is like, we are used to eat salt. How can I eat without salt? Now you can enhance the taste of your food, I would say, by adding some other ingredients like onion powder or garlic powder or white pepper and squeezing small lime or lemon into it. So that's the way you should try to initially at least try to avoid salt and enhance the taste of the food. So I prefer not to add extra salt while cooking rice or preparing taus for rotis, and do not eat ready to consume foods or processed foods or packaged foods. That's very important for you. And if available, whenever you're taking any packaged food, please read the label, and if there is any food product that has more than 140 milligrams of sodium per serving size, try to avoid that food or try to restrict the quantity of the food. And if you want to eat snacks which are generally deep fried and requires a lot of salt, try to replace that snacks with small servings of fruits or salads to have a snack. So that's what generally we recommend. And the other thing is the hidden salt. So generally many of the times we see patients blood pressure not being controlled, and we keep advising them not to take salt. Then they say that, sir, I usually don't take salt at all in my food, but I just add one papad or add some pickle. So that's not going to help you. These are the hidden salt in your food. So you take some potato chips, you take some small salted biscuits, salted popcorn, namkeen, everything. These are hidden salts. So try to avoid the hidden salts. You take some pickles, ketchups, all those things are hidden salts. So make sure that when you are eating anything, try to get a hang of how much sodium is there in that food, and try to avoid the food with high sodium content. Now let's come to the potassium, sodium and potassium. So these are the electrolytes. So electrolytes are very important. So as much as sodium is important, potassium is also important. So potassium helps in pumping of your pumping capacity of the heart and working of your muscles and nerves and everything. And any low potassium can have your heart irregularities and heart attacks. And even high potassium can cause heart attacks. And high potassium can cause muscle weakness, low potassium can cause muscle weakness. So you have a balance, should have a balance of potassium. So most of the times potassium you get sources from oranges, peaches, pears, and all those things. Fruits where you have high potassium, and you have dry fruits which have high potassium. So all the patients who are taking certain drugs like telmisartan, Telma, you get Olmegest, all these tablets which can increase your potassium. And top on that, if you're taking increased dietary potassium, you can land in trouble. So you have certain vegetables also which are very high in potassium. So if your doctor advises you to take less amount of potassium, so you should try avoid vegetables like round gourd, snake gourd, or pointed gourd, and fruits like pears and bananas and all those things. And you have raw rice and cereals like millets will have high potassium. Dry fruits will have high potassium. So potassium is very high potassium and very low potassium is not good for you. So if your even leafy vegetables have very high potassium, tomatoes have high potassium. So how can you get rid of potassium? So you have something called this is only for patients who are renal patients and who wants to get rid of the potassium. There is something called as leaching. So what we advise is patients to boil the green leafy vegetables or the vegetables. This will help in leaking of the potassium from the vegetables into the water, and you discard the water and use the vegetables. This technique is called leaching. So this leaching will help to reduce the potassium content in your food. But the downside of this is that when you do that, other nutrients also go. So we don't advise leaching for everything. Leaching is only for products which have high potassium in it, like green leaf vegetables and other vegetables which have high potassium. The moderate potassium vegetables, you need not leach, you can just directly consume them. So potassium is very important. So in healthier individuals, if you're exercising and if you're exercising and you have a good amount of physical activity, you need potassium for your muscle strength and activity also. So you can have a normal good amount of potassium. But patients who are on certain drugs for hypertension and kidney patients, they should watch their potassium. So you should not eat too much potassium also. And after the potassium, you have phosphorus. Now the phosphorus is very important for you, for your cells and cell membranes, and to maintain your bone health also. So having said that, the kidney patients generally will have tendency to accumulate this phosphorus. The general population usually doesn't have this problem. Only the patients who have kidney disease, who have the moderate dysfunction of the kidneys, will have this problem. So we advise them to take low phosphorus containing foods. So the phosphorus is usually high in meats and meat products and dairy products. So and chocolates and nuts. So we advise our patients, generally the kidney patients, to avoid high phosphorus foods. And if you want to take dairy products, all these kidney patients and all, you can rely on some skimmed milk or low fat milk, which is low on phosphorus. Now coming to iron is very important to you. So you should know what are the foods which contains iron, like your dates, dry fruits, eggs, and legumes. It will help in maintaining your hemoglobin. All the renal patients or kidney patients will have low hemoglobin because of decreased secretion of hormones called erythropoietin, which is usually secreted from the kidney and will maintain the hemoglobin. So you should have food which is rich in iron so that your hemoglobin is maintained. Zinc is also very important for the growth and maintenance of body hormones. So important sources of zinc include avocados, raisins, whole grains, meat, and fish. So these are the more or less, these are the micro elements or trace elements which you should be aware of. And coming to oil, which I've already mentioned. So oil, you can have up to 3 to 4 teaspoons of oil or 1 teaspoon of ghee a day. And whenever possible, avoid vanaspati, ghee, butter. Try to avoid these things because these have saturated fats. You should take unsaturated fats. And then whenever is a possibility, avoid deep frying and try to boil your foods or steaming your foods, which is better. And don't add refined sugars and sweets to your food. So this much restriction is required on oils and fats. Now the last topic is on the water. Now before starting on water, I'll talk about 4 myths usually which are asked in our regular daily practice. The first thing they'll ask me is how much water I should drink. Now there's no universal answer for this. The amount of water you require will be different. It depends upon what are you doing, where do you work? You work in open sun or you work in AC lounge, and what is your physical activity, and what is the climate you're living in. Based on all these considerations, will tell you how much water is required. So many a times young patients come to me and ask me, sir, what is this 8 glasses of water? You must have heard you should drink at least 8 glasses of water every day. Well, that's a myth. The fact is you should drink as much as water as your body wants, not 8 glasses of water. Okay. So that's a myth. There's no scientific evidence to say that you should drink 8 glasses of water per day. You might be requiring more than 8 glasses of water per day, and you might be requiring less than 8 glasses of water per day. So there's no magic number to say that I require only 8 glasses of water per day. And the best thing to rely on is your thirst. If you're thirsty, that means you need water. If you're thirsty, that means you're not dehydrated. So the second myth is if you're thirsty, you're dehydrated. No, that's not true. If you're thirsty, that means that your body needs water. That doesn't mean your dehydration. So to get a perspective of that, I'll just tell you, if you're thirsty, that means that there is a water reduction in your body up to 2%. But to say if you're dehydrated, you should have at least 8% reduction in your body. So thirst is a mechanism to prevent dehydration. So that doesn't mean that if you're thirsty, you're dehydrated. So thirst is a mechanism which will help you to keep you hydrated.
And the third myth is most of the times they ask me that sports drinks are the best option after exercise. Now, many patients comes to me with an ask who generally goes to gym and do a lot of workout and ask me that I take a lot of that protein, that energy drink, this energy drink. Is it necessary for me? Now, protein drinks are good in one way, but it is not required for you. They have a lot of electrolytes which needs to be replenished after a heavy workout or heavy exercise. This is when you're exercising hard for a long time. But for a routine exercise, you can just get away with plain water. So you need not drink artificial water with electrolytes every time you work out. So the electrolytes can be replenished with your food and with your diet. So you need not take artificial water with electrolytes. Just plain water is enough if you're regularly working out. But yes, if you're exercising hard for a long time or long distance running, hours of hiking in hot sun, that's the time when you require these electrolyted water. The last myth is water flushes out toxin in my body. Now, many patients who are not renal patients, who are long-term diabetics, who comes to me and asks me, sir, I drink 7 liters, 8 liters of water per day, but still my creatinine is not coming down. I'm not able to flush out my toxins. So water is not going to flush out toxins from your body. That's a myth. Okay. So your detoxification process will require only certain amount of water. So any water above that is not going to help you. So you need only as much of water required to function these organs. So what happens when you take excess of water? So you can have problems like psychogenic polydipsia, polyuria, and you can dilute the electrolytes. The sodium and the potassium, which I've been telling you, can get diluted when you take excess amount of water, and that can lead to a condition called hypernatremia, which is usually very rare. We don't see people who are taking excess of water and coming with hypernatremia, but that's a possibility. So how much water you need depends upon your age and your working atmosphere and your climate. So based on all these things, roughly any male who's working outside will require around 3 to 3.5 liters of water per day, and any female will require around 2.5 to 3 liters of water per day. This is a rough estimate in a temperate climate, like in climates like India and temperate climates near to the equator. When you go to climates which are really cold, you might not require this much amount of water. And if you go to hot climates, more hotter than our climate, you might require more amount of water. So there's no magic number on how much water you require. It depends upon what you're doing, where you are, and what work you're doing. So having said that, I want to talk about a recent study which was conducted in AIIMS Delhi. They have questioned around 400 general public, and they have looked at the knowledge of dehydration, and it's really amusing that only 40 to 50% of the population have answered correct. So most of them doesn't know what exactly is dehydration and what are the signs of dehydration, and most of them thinks that only only taking water will help in dehydration. No, you can take any form of liquids like juices, teas, all those things, and you can also take food with high water content like your watermelons, oranges, apples, and along this fluid, this also helps in replenishing your body. Now, when you get dehydrated, you can get a lot of problems. As I told you, a 70 kg human being, a male will require approximately around 3 to 3.5 liters, and female will require around 2.5 to 3 liters of water per day. Okay, and so the important thing you have to understand is that when you feel, how do you know that? The other question I generally I'm generally asked is, how do you know that you're drinking enough water? Now, the most of the patients and some other people keep asking me, doctor, how do you know that? How do I know that I'm drinking enough amount of water? So as long as you're not feeling thirsty most of the day, and as long as your urine color is colorless or light yellow, you can it's a sign that you're drinking good amount of water, and you should make sure that you drink water in between each meals. And you should drink water before, during, and after the exercise. And whenever you feel thirsty, you drink water. So if you're not feeling thirsty most of the day, most part of the day, And if your urine color is okay, like light yellow and colorless, that means that your hydration status is good. Now, should I worry about drinking too much water? Is not very much. But if you, it's not recommended to drink too much of water, which can lead to hemodilution and dilution of your electrolytes. So there should be a limit. You should not drink too much, like 7 to 8 liters of water. And plain water is as good as anything else. So you need not have any energy drinks or anything. So I think with that, I'll stop here. And thanks for giving me time for interacting with you. Thank you.
Thank you so much, Dr. Satyanarayana. It was an amazing and informative session, and everyone on Facebook are commenting. It was indeed an informative session. Thank you so much. And yes, definitely have lots and lots of questions for you.
Yeah,
so,
please.
talking about water, so what do you have to say about caffeine and tea on with renal diet?
See, this, as I told you, you should avoid the milk and milk products in patients who are having renal disease, because milk and milk products are very high in phosphorus, which is not good for kidney patients. They're going to weaken your bones. So the recommended milk intake is around 3 ounces, that's around 150 ml per day. And try to take skim milk or low fat milk, which is low in phosphorus.
Okay.
And as such, to caffeine and tea, there's no contraindication. So you can take caffeine and tea in a limited quantity, not too much of quantity, because of a lot of medications, these people will have a lot of gastritis. To add that, if you take caffeine and all, it can increase your gastritis. So
Okay.
you should try to limit your caffeine.
All right. Okay. So next question is, what about consumption of protein powders?
So we have morning itself, I saw one patient, this young boy who's around 24, 25. So this boy around 25 who goes for workout regularly, and he consumes around high protein. He didn't tell me what protein he takes, but he takes good amount of protein supplements. Protein supplements, you should be very, very careful while taking protein supplements. It can harm your kidney. Too much of protein is going to damage your kidney. So as I told you, the recommendations for everything. If you are doing muscle building activities, you can take up to 1.5 grams of protein per day. So calculate. So they should be balanced. You should calibrate everything and take if you are taking too much of protein. So don't go hard on protein. So calculate yourself. If you're doing muscle building activities like weights and all, around 1.5 grams per kg of your body weight is required to have a good amount of muscle buildup in your body. Anything more than that is not good for you.
All right. And how about supplements? You spoke about supplements. So how about supplements like omega-6 and collagen? So these days collagen are really important. People are consuming collagen. So how about that? Like comparison to in contrast to this renal diseases.
See, omega-3 fatty acids and omega-6 fatty acids are very good. As I told you, we have two kinds of fats, saturated and unsaturated fats. So these are liquid fats which are actually good for you. You should make sure that you should include these omega-3, omega-6 fatty acids in your body and your diet also, because these have a lot of antioxidant property. So all these chronic problems like diabetes and hypertension and all these diet related issues is because of the inflammation in the body. So to fight the inflammation, you need antioxidants, which is very rich in these omega-3 fatty acids. So whenever you taking oils or fats, make sure that you take oils or fats which are very rich in omega-3 fatty acids, omega-6 fatty acids. In fact, there are many diseases in kidney person diseases. For example, we have something called as IgA nephropathy, where fish oil is given as a form of treatment.
Okay.
So omega-3 and omega-6 are good, and collagen you can take because it's good for your skin and all, but otherwise it doesn't have a very good antioxidant properties like omega-3 and omega-6 fatty acids.
Okay. All right. Great. So another question is, someone asked, is MR wheat is better than a refined wheat?
Sorry, I get you what?
MR wheat must be a kind of type of wheat which is different from wheat.
The thing is this: you have whole grains and refined grains. Always try to include whole grains like whole wheat, whole rice, all those things. Those are good for you, because the refined grains or the polished rice and all those things will have simple carbs, which is not good for you. Whole grains will have complex carbs, which is good for you. So always try to include whole grains in your food, not the refined ones.
I
And
don't know
how?
what's the wheat, but if it is I'm assuming it's a whole wheat or something like that.
Okay. And how about brown rice?
It comes as a complex one. That's what I'm telling you. So it's not refined. Brown rice or red rice comes under the category of whole grain.
Okay.
Whereas your white rice comes under polished grain or
Okay.
refined grain.
Okay. Great. So another question is there anything particular, any food to avoid for kidney disease?
So as I told you, see, most of the times what happens is problem comes with this. Kidney patients know what happens. Most of the time they suffer from long-term problems like long-term hypertension, long-term diabetes. Now, controlling of hypertension is very important. So avoid these high sodium containing foods. The problem comes with the hidden salt. Hidden salt comes like, for example, you eat some papads, but you don't add salt in your food. That doesn't make sense. Okay, you're going to eat the same amount of salt. It's not going to help you. You eat pickle, but you don't add salt in your food. That doesn't make sense. So
Right.
on the whole, you should have a diet, a balanced diet, and you should make sure that you should have every component of each and every component in your diet in a limited quantity.
Okay. Okay. All right. You have already explained that. Great.
Yeah.
So another question I have received is, are fat burners affect the kidney, or if someone is trying to lose weight and is not able to do and have to consume fat burners, so what impact will it create?
Now, coming, see, this is very important. Now, we have seen a lot of patients. Lately we have seen a lot of diets. We have paleo diet, we have keto diet, we have some Veeramachinami diet, we have that diet, this diet, and all. So, as I told, you can't. For example, you have four tires in a car. You can't take out one tire and say that I'll run in.
Absolutely.
Also, you should have each and every component. Only diet will not help in reducing weight. So you have to do exercise. You have to balance your diet. Don't take a very singular diet. I'll take only fats. I'll take only keto. I'll take only fats. It's not going to help you. Okay, and it will put a lot of stress on your body. The stress is bad for you. And
Right.
take only protein. That's also not good. You should have a balanced diet and you should exercise. You should do workouts and you should complement that with the diet. Diet should not be complement with the workout. So it's physical activity plus diet. Both goes hand in hand. Well, it's unfair to say that I'll do only dieting. I'll not eat at all. I'll not eat for 2 days and I'll reduce weight. That's not going to help you.
Right. Wow, so it was an amazing session, and I actually took a lot of points back from this session, like about potassium. It was indeed a very much informative session, and thank you so much, Dr. Satyanarayan, for coming and sharing this information. And thank you so much to for your Kidney Foundation and Mohan Foundation.
Thank
So
you.
this,
It's a pleasure to be here today.
thank you so much. Thank you for this.